This is Dr. Thomas Gibbs and Glenn Ellen, and welcome to our webinar on replacing teeth with dental implants. We're going to be talking more about single teeth here, partials, dentures, bridges. We do have another video on replacing entire dentures with dental implants, so take a look for that also. Certainly, implants are a modern miracle. We can do these far more comfortably, predictably, aesthetically than we ever could in the past. You don't have to live with all the problems you've had in the before. Certainly, big advantage to dental implants are the success rates that we achieve with these. Much higher, certainly at the 5-year, and it even gets to be a greater success differential. We go to the 10-year mark there. Then, say, for instance, removable partial dentures, conventional bridges, resin bond bridges, dental implants. Again, we've achieved the highest long-term success rates. What is a dental implant? Basically, think of a dental implant as being an artificial root made of pure titanium. The bone actually integrates, fuses to the bone. It's a very strong, very biocompatible type of a fusion there. You can see there in the middle x-ray there, the dental implant pretty much takes the place of a root. You can see it being placed in the left, and on the right looks just like a regular tooth. Here's a problem with a front tooth here. If you look at our other video on that discusses the problems of waiting too long to get these procedures done, you would see that one problem with waiting is when you lose the tooth, you lose the bone that supports that root, and the bone basically withers away. If this lady had had a bridge in that spot where that bridge would, where that tooth was lost, the bone would have withered away, and 5 years, 10 years down the line, she'd be getting food caught beneath that bridge. The dental implant not only gives us a very aesthetic result there, but we don't have that bone loss. We don't have to wither down the adjacent teeth. Dental implants can be used either by themselves or in conjunction with other implants. To get long-term bridges. Here's one on the top. We're actually replacing an entire denture with implants, and some other options there. We're actually using implants to hold or stabilize dentures. Take a look at the picture on the bottom right. If a bridge there, we actually get to cut down the teeth on both sides. Dental implants, we do not. Dental implants will work by themselves. We have a very detailed chart here going into the advantages and disadvantages between bridges and implants. Look at this in more detail on my website, livewithoutdentures.com. But you can see basically the procedure is this is replacing like a partial or either here's or even an implant bridge. You have the space, you put the implants in, you put basically bolt that bridge down. Here's another example of a implant crown. This was one actually done on the top left about 15 years ago. The materials we have are now more aesthetic. Looks like that tooth's just growing out of the tissue there. We can get much more aesthetic results. Here's an example. This lady hated her partials. Her tongue was bumping into. She was getting food caught. Put in 2 implants there. It looks and feels just like regular teeth. Again, another case in the front here. If I were doing that today, this is one we did about 10 years ago, we would even use better looking materials than we had then. So lots of advantages and disadvantages between implants and removable partials, but one you should also take a look at there. You get all the way up to the point of large partials or dentures. One problem is that you lose your your ability to chew. You look at people who have sunken cheeks. Basically, that's due to the facial muscles atrophying because they can't chew as well. Dental implants, we don't have that problem. The bones maintained, the muscles are maintained. Again, more advantages and disadvantages. Those clasps hold in plaque, they torque the teeth. Dental implants, you aren't going to have that problem. Certainly some of this is comfort and aesthetics. Also, a lot of it is just quality of life too. Oldest lady I put implants in was 92. We put 3 implants in the top, 2 in the bottom. This lady was someone who could not smile, chew, talk. Once we put those implants in, she was able to smile, chew, talk, eat again. She had a real quality of life issues for many of these people. Comments from patients, take a look on our website, a lot more patient feedback on this. Again, some of these are real quality of life, life-changing, life-improving type situations. Experience, certainly to do this kind of stuff, you have to have a lot of experience and training, and we do keep up on that. There's more on this on our website also. Alternative solutions, again, go to our website, call our office, 630-858-8800. If you want more information, we can be more than happy to send you a free report. Just leave a message at that phone number, 888-368-0273, and we look forward to hearing from you in the future. Thanks for listening. Bye-bye.